Welcome, everybody, to the podcast. We have a great episode today, a really topical topic talking about physician, healthcare worker, mental health, and wellness, and all that stuff. I have Dr. Dimitrios Tsakiris. He is a board certified practicing psychiatrist specializing in the field of anxiety management. He is a clinical assistant professor of psychiatry at Northeast Ohio Medical University. He studies and writes about the interface of anxiety and achievement. His popular Psychology Today blog, Anxiety and High Achievers, has been read by more than 600,000 readers. He's a TEDx speaker who speaks on the topic at national conferences, academic institutions, and professional society meetings. He's passionate about empowering people to break free from the shackles of anxiety and develop a healthy relationship with achievement. Through his work as a psychiatrist, writer, and speaker, he seeks to fulfill this mission. This was a great talk. We had a good time. We'd worked before in the past, so it was a good way to reconnect as well. So enjoy the episode. All right, everybody, welcome back to the show. We have a great guest on the show. This is Dr. Dimitrios. I'm going to let him introduce himself first, and then we'll ask him the surprise question and go from there. So,
Hey, Dr. Sulman, it's good to reconnect with you again.
yeah,
So I'm Dr. Dimitrios, practicing board certified psychiatrist and clinical assistant professor in Northeast Ohio. And I, study and write about the interface of mental health and achievement. I write for the blog Psychology Today, and I've also had the opportunity to, to speak on the topic. Actually, this upcoming Wednesday, we're presenting at the American Psychiatric Association, so I'll be flying out in a couple of days to San Francisco, and looking forward
yeah.
to meeting some of our colleagues there.
I know. I keep I think I'm not necessarily a member. I keep forgetting to renew my membership, and then everyone's like, "Oh, are you going to the meeting?" I was like, "Oh wait, the meeting's happening now." And I was like, "Oh my god, I have to remember to go to one of these one day." So
Yeah, a lot of folks there. It's a good place to connect with our fellow
yeah.
peers from different parts of the country. Yeah.
Yeah, I know that we originally connected through Clubhouse. What was it, like a couple years ago, where I think it was? And remember Clubhouse before? I think Clubhouse has died essentially. Twitter Spaces has kind of taken that over. But Clubhouse, we were part of like this group where we get together on Sunday nights and kind of open it up and discuss all kinds of things. So yeah, we were doing that for a little bit, and then it kind of like fizzled out a little bit. So
Yeah, but it's really nice to connect with peers. Sometimes it feels like we're isolated, just, going
yeah,
through the grind. And it's kind of nice to meet with peers and share thoughts, and
yeah.
also even just meet in person. So again, thanks for having me on the podcast. Really excited to have the opportunity to be here.
Yeah, absolutely. So, first question we'll ask you, right? I get this question a bunch, and I think it's interesting when I get it for other people, but how do you pronounce your last name?
My last name is pronounced Dr. Tsatiris, like satire. If you want to say it the Greek way, it's Tsatiris, but most people struggle with that ts in the beginning part of the name. So uh, I just call it Tsatiris, like satire, to make
Yeah.
everyone's life easier. Yeah.
How often do you get that question from people?
Quite a few times, but that's why I go by Dr. Demetrius most often. That way
Yeah.
that's a little more easy for people.
Yeah. I think it's one of those things that like people don't always, when people look like me, when they're brown people or they're like not necessarily born in America or whatever else, people are like, "Oh, how do I say your name? And am I saying this or I'm not even going to try to say your name." But then we have white peoples and then, and then the people are like, "Wait, how do I say this? How do I do this?" So, all right. So, we're going to start off. We were going to discuss high achieving people, anxiety people, and then kind of a little more focused about on healthcare providers, doctors, nurses, etc., and kind of their mental health, right? Because I
Right.
think it's something that a lot of people know about but don't talk about, and then there's a culture around it and everything like that.
Yeah.
So let's jump into that topic. Tell me a little bit about like what kind of like your work, your specialty is, and then we'll kind of dive in.
Yeah, definitely. So, I've had the privilege of working with, people from all walks of life, many of whom are very, achievement oriented. For my hospital, for example, 2 days a week, I treat the physicians. Two local hospitals, Summa Health System and Akron Children's, are both in Akron, Ohio. They created a not-for-profit the Akron Physician Wellness Initiative, and through that, I've had the privilege of treating quite a few docs in the area. But also, like in the community, I've had the privilege of working with many achievement-oriented people from all walks of life, business leaders, lawyers, dentists, you name it.
Yeah.
And having that experience, I guess gives me some um, understanding of what achievement-oriented folks go through and how we can help them.
Yeah. I mean, on your end, what do you see as like the most common struggles that they're going through? These higher achieving people, per se, higher achievement, I should say, not higher achieving, right?
Yeah, yeah. I mean, from a mental health standpoint, what I observe is a high amount of depression and anxiety. And what I try to teach them is that, just because you're doing well in one facet of life, like professionally, that doesn't make you immune to suffering, right? An
Yeah.
example might be somebody who appears cool, calm, and collected at work, and they appear confident and they're carrying the load there. But then when they come home, they appear to be easily irritated, tense, stressed. They're not connecting with their kids or their spouse, and they might need a couple drinks at night
Hmm.
to cool their nerves, right? To calm down their nerves. And what I try to teach them is that if you don't take care of all this other stuff, eventually it's going to come back to bite you and impact your ability to work and your work performance. So what I try to teach them, what I try to help them with is finding that balance between being achievement oriented, but also prioritizing their mental health.
And it's hard, right? Because of the culture of medicine, I think, right? Medicine as a whole, the caring professions, right? Dentistry and as well, nursing, etc. All that stuff is you're taught from like the beginning to be selfless, right? And to take care of other people. And, even before the residency hours were changed, it was like just work, 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 and no matter what. And that's end of the day, that's what's the most important stuff. So what are some ways I think to kind of combat or kind of unbreak these tight bonds that are there with this?
Yeah, I mean, there's a couple layers to this. If we're going to talk about achievers, what I would
Hmm.
say is that society has become more competitive. Behaviors associated with the attainment of status and success, they're on the rise. So as a result, we're pushing ourselves harder than ever before to achieve our goals. And this makes sense, right? Like when you think about our parents, in that generation, you get a college degree, you're set for life professionally. Today, though, if you get a college degree, the only thing that you're guaranteed with is student loans,
Student debt. Yeah.
right?
Yeah.
So society is more competitive. The other thing that achievers do, the one trap that we fall for, is that we tie our self-worth to our achievements.
Hmm.
So if we're not achieving, we don't feel good about ourselves at all, right? And what I try to teach people is that your self-worth, it goes beyond your successes and failures. My dad's a cook, my mom's a cashier at a grocery store. Money was tight growing up.
Yeah.
Through their love and support, I've become a doc. Um, I am not more worthy than my parents because our worth is part of our humanity. It's an innate, essential part of who we are. And what I try to help people do is tie their self-worth to their humanity, not their achievements. Um, as far as healthcare now and physicians, what we struggle with is the fact that there are so many systemic factors that are at play that when combined with our personality traits, they make us vulnerable to suffering, right? And
Yeah.
if you want to, we can dive into some of these systemic forces
Let's
that,
let's do that because I think a lot of people sometimes, I think us as like healthcare providers, as docs who are working in a hospital system, like we know the
yeah,
drama, we know the kind of the stressors that are kind of there. And a lot of it is kind of we've just assumed it. We're just like, okay, this is part of the deal, right? This is part of the price per se that comes with the cost that comes with working in a healthcare system versus going into private practice and things like that. So yeah, if you don't mind talking about that a little bit.
yeah, I mean, definitely. So, one example of a systemic force that impacts the mental health of physicians is the culture of medicine, right? We're taught to
Yeah.
be stoic, we're taught to sacrifice ourselves, and as a result, prioritizing our mental health doesn't come natural to us. Another example is the bias in medicine, right? There's discrimination against women, for example, who get paid less than men,
Hmm.
or international medical graduates, right? There's even interspecialty discrimination, I would argue, where maybe some specialists look down
Yeah.
upon primary care or psychiatry, right? For employees, there's often a loss of autonomy that happens. And it's really hard for a physician to we've worked so hard to become physicians, but then people who do not have a medical background make decisions that impact our ability to practice day-to-day medicine, right?
Yeah.
So that's another example of a systemic force. Also having inequality metrics that are often not congruent with quality care. An example may be patient satisfaction scores that employee physicians have to meet, right?
Hmm.
I'm thinking about if a patient came to me and they're struggling with alcoholism and they ask for a controlled substance like Xanax to calm their nerves, to cope with
Yeah.
anxiety, right? And I say no to them, that's good quality care. Like you don't want to give Xanax to somebody who's struggling with alcoholism. They may overdose and die,
Sure.
but I might get a poor patient satisfaction score that hurts me, right?
Yeah.
What other forces? Oh, the fear of being sued. That's another one, right? Where
Yeah.
we're expected to be perfect. And if you make one mistake, and have one negative outcome, there's the risk of being sued,
Yeah.
right? So there are all these systemic forces that I can continue to talk about that impact our mental health. And
Yeah.
then when you combine them with our traits, it creates a cocktail that makes us vulnerable to suffering.
Yeah. I think we know, like in our work, you touch up on it with the administrators who make decisions for us and have to have control over how we do our work, right? I think all docs who have like complained, right? I think a lot of we like to complain. Anybody who's like complained or spoke up or said something about it, I don't think they dislike being a doctor and doing doctoring, right? They like the physician part of it. They like working with patients and a team and all that stuff. It's the healthcare. I mean, it's the management stuff, right? It's the aspect of being told that you have to do things in a certain time period, a certain way. Documentation has to be a certain way and done by X, Y, and Z, like all these kind of outside stuff that gets in the way of the patient doctor bond and what the work is, what we
Yeah.
got into it for.
It's the loss of autonomy, right?
Yeah.
It's being seen as a resource instead of a human being. There's a reason
Hmm.
there's an HR, human
Yeah.
resources, right? So we're
Yeah.
seen as a resource, like how much are we producing? And when hospitals go through challenges, financial challenges following COVID or being short-staffed, what do? They ask the doctor to do more work,
Yeah.
right? So it's that loss of autonomy and being seen as a resource instead of a human being that really hurts emotionally docs at the end of the day.
Yeah. And how ultimately it comes down to dollars and cents, right? So
Yeah,
end of the day, that's
yeah.
how it goes. So I think it was actually when you had mentioned that there was tell me about that. There was the coalition that was there between the physician wellness thing about that. Tell me about that
Yeah, yeah.
real
So
quick.
here in Akron, we
Yeah.
have the Akron Physician Wellness
Yeah.
Initiative. It's a not-for-profit between two local hospitals where we treat the medical staff of the two hospitals and we provide free and confidential care, which has been really a rewarding experience.
Yeah. One of the most common things, right, when people talk about physician mental health and any kind of healthcare worker mental health is there's that question that shows up on a lot of the licensing, the state licensing, right, applications. Are you receiving any kind of mental health treatment? And for a lot of people, a lot of states, right, I think there's been a move to kind of get rid of this, but it's not struck down everywhere yet. So I think it's really brave when you guys have a program that's there to be like, hey, we are acknowledging that this happens and we have set up a place for you, a resource for you to go to, because a lot of times that's a barrier, right? That's one of the things that people will not seek out that care for because of that, correct?
Oh, 100%. I mean, there's a number of barriers for us getting help.
Hmm.
One of which is the fact that like state medical licenses ask these questions. And the irony is that by getting care, you become a better
Yeah.
doctor, spouse, parent, right? But when you don't get care and you live in secrecy, that's when suffering grows.
Yeah.
Suffering grows in isolation, right?
Yeah.
And it, it's unfortunate that we have these barriers that prevent us from getting the care that we need, because at the end of the day, we're human beings. And just because we're performing in one facet of life, it doesn't mean that we don't experience our struggles like any other human being, because life is filled with daily challenges.
Yeah. And when we suffer, it becomes into depression. And when we're not allowed to necessarily, supposed to get treatment, right? Then we find treatment in other ways, correct?
Yeah, we do, right? We take matters in our own hands. And, one way that we take matters in our own hands is we drink, right? For example, right?
Hmm.
Or we use comfort food, we eat, or we gamble, or we engage in unhealthy behaviors because we're trying to escape suffering. And one way that we do that is via self-soothing, self-medication. There
Yeah.
was a survey they went out to that was responded to by 7,300 physicians, and it showed that about 13% of male physicians and 21% of female physicians, and I can share this study with you, they
Sure.
met criteria for alcohol abuse or dependence.
Yeah.
And I would argue that those numbers are even higher because that survey had a low response rate. It was sent out to 27,000 docs. So it had a response rate of about 27%. And let's be real here. If I'm struggling with alcoholism, am I really putting that on an online survey that's quote anonymous that can somehow, some way come back and
Yeah.
be linked to me? Of course not, right?
Yeah.
But that's what happens when you don't allow people to get care. They get matters in their own hands.
Hmm.
And some of those ways that we approach receiving care can be unhealthy and even exacerbate the original problem.
Yeah. I think, again, I do a lot of work with like addiction work and alcohol. I love working with alcohol and talking about alcohol in a way,
Yeah.
just because we know that, it causes, does it help depression and anxiety in the moment? Sure. Right. No one's denying that. It makes you feel great. And then you don't have to worry about stuff. And then it wears off. And then everything is worse. Right. And it makes it all worse. And how do we fix it how do we fix it when it wears off? We drink some more. Right. Because we know that that worked. And then it just creates this vicious cycle.
Yeah.
So,
And then we create a relationship with the alcohol,
mhm.
right? Because it happens in isolation, we push away our loved ones
Yeah.
and we engage in this behavior in secrecy. We hide the bottle, right? And when we look at the data, we see that 75% of cases, when there's comorbidity between alcohol and anxiety, in 75% of cases, the anxiety disorder comes first, followed by the alcohol use.
Yeah.
So when people are struggling with anxiety, what's a logical thing to do? Have a drink,
Yeah.
right?
Because we get these social messages as well from people like, "Oh, you're so tight. Just have a drink, loosen up," right? And
Yeah.
it's just the reinforcement, and then you do, and it does, and so on and so forth. There's just basic human psychology, right? So
Amen.
that's all right. What? So then, and then when this kind of gets to a point, right? So the logical endpoint is we have super high suicide rates, unfortunately, in the field, right?
We do. We do. Yeah. There was a Medscape survey that came out about a year ago, and it showed that 10% of physicians either experience thoughts of suicide or have attempted suicide. 10% of physicians. And again, the number is higher because when you look at the survey, 4% say, I don't want to answer.
Yeah.
Okay, so the numbers are probably higher, and they're higher compared to the general population. And
Yeah.
that's what happens when you're desperate. When you feel desperate and you feel your back's against the wall, then you engage in desperate ways of thinking and behaving. And it makes sense to me, right? Because we've spent as physicians many years to get to where we're at, right?
Hmm.
4 years of college, 4 years of med school, 3 to 7 years of residency. Many docs specialize in fellowship. We come out with 6 figures of student loans. We put all our chips in medicine. So then when you come out and medicine isn't what you thought it was going to be, that's
Hmm.
a very disheartening and deflating experience. So it makes sense that you want to escape that feeling of helplessness and hopelessness. And it makes sense that then you would start to consider and reflect on suicide. But when in isolation, suicidal ideation grows and it festers
Yeah.
and you think about it more and more, and then it's only logical that you would at some point plan or attempt.
Yeah. And the other thing too is that, again, people don't always understand is that how traumatic medical training is, right? Not just from people are like, oh, it's terrible, and there's an abuse system, and you're from attendings and other people and other residents, etc. Like, yeah, that's there too. We know that's there, but then we also know from the fact that, like, again, the work that we're doing, the medical work that we're doing, people die, right? Patients die, patients get sick. I always remember when, I do a lot of child adolescent work, and and during my my internship, I rotated on the pediatrics floor, pediatric medicine floor. And I would see the pediatric oncologist just crying in the hallway all the time. And I was like, oh my God, I could never do that work. And then they look at me and talk with me, and they're like, oh my God, you're doing child adolescent psychiatry. I could never do that work. Right. And it's the constant aspect of like, nobody can do some of this work. And that trauma as well, and then the training trauma, and it just goes on, right?
100%. That's an excellent point, right? That people don't come to see us because they're happy. They come to see us because there's a problem,
Hmm.
and we're in the front lines of trauma, be it seeing it, like critical care ER docs, right? Or actually hearing about it, because adverse childhood events are very common, right? And
Yeah.
many of our patients, they've experienced some sort of traumatic event in their lives, and we're exposed to that, and we're trying to process that with our patients, right? And you do that day after day after day. It's not realistic to expect that physician, that human being, not to be impacted by that,
Right.
right? So then to like ask questions about us seeking help, it just, which is a barrier to us seeking help, it just doesn't make much sense to me.
Yeah. And it's, yeah, again, and then I work outside of like the DC area. So I work with, federal agents, FBI people. And I talk about it like that. I've worked with people who do like child pornography kind of agents, right? They do a lot of the work for that kind of stuff.
Mm,
And they're limited, right? A lot of like these agents, they're limited to like how many years that they can do that work for, right? Because they know, FBI and everybody, these agencies know that, like, hey, you try to tell people to look at this stuff for decades, what's going to happen to them? They're ruined for life, right? And those same privileges, those same protections, don't extend to medical people work, right? We're expected to work until we're like 67 years old, right?
yeah, I don't understand the double standard. I agree with you. I think
Yeah,
society puts these unrealistic expectations on us as if we are not human, right?
yeah,
And we try to fulfill these expectations either within the culture of medicine or even from society. And it's just not sustainable long term. So I
yeah.
completely agree with you. Yeah.
And all that's happening regularly. Like if everything was all well and good, that's just a normal day in the life of healthcare workers, right? And then COVID happened, right?
Yeah.
And
That
then
helped,
COVID
right?
happened. Yeah. How from what your experience, what you saw, I know everyone has got like their stories and stuff, and people are like, "Oh, we're done with it." I was like, "We're not fully done with COVID, right?" But how is that? What has been the impact that you've seen amongst the people that you work with?
Yeah, I think it's gone through phases. I think initially when it happened, people saw us as heroes, and we were idealized. And that felt good. It reignited our passion for medicine, at least initially. But at some point we were vilified, because let's be honest, the pandemic wore people out. And when we're, you know, encouraging vaccinations and taking safety measures, you can imagine how, people might have, scrutinized us, for example, and looked at us as like being in with pharma, for example, right? So I think a lot of physicians have been emotionally hurt from the experience. They feel maybe betrayed by the fact that, like, hey, I made these sacrifices to try to promote health, and what I'm getting is being looked at as the bad guy. And an additional layer to this, from a pragmatic standpoint, is how hospitals are hurting financially from the pandemic.
Hmm.
Many hospitals are, for example, short staffed. They have a hard time getting enough physicians or nurses. So, what's happening now? They're putting more pressure on the docs, the ones who are remaining. And you got to see more patients, you got to get double booked, right? And this is increasing one's level of anxiety trying to keep up with ever increasing expectations,
Yeah.
right? So we're short staffed and the hospital's struggling financially, hospitals are struggling financially. And what's their logical solution? Ask the doctor to do more. which
Yeah.
will only make us more vulnerable to burnout. It's a vicious cycle, right?
Yeah. Yeah. No, and then they wonder, right? Because they're just like, oh, why are you threatening to leave? Why are you looking to go private or kind of get out of the healthcare system? It's because of this, right?
Yeah.
And I remember I was talking to somebody recently, Dr. Kristen Casey, and I was asking her, I was like, what's your self care? And her thing was like working less, right?
Yeah.
And that opportunity isn't always afforded when you're employed, right, by the hospital system or the
Yeah, or if
healthcare
you're coming
system.
out with like a quarter million in student loans, like when you're
Yeah.
coming out, I mean, working less can impact your ability to provide for your family or pay off
Hmm.
student loans, right? So
Yeah.
not everyone can afford to do that. Here's a question for you: how has the pandemic impacted private practice? Do you have any observations?
We've been booked to the gills, right?
Okay.
It's one of those things where, so again, my main job is working with kids and adolescents through the hospital system, but then I do have my private practice on the side, where I do work with adults. I was overloaded, right? I
Hmm.
could not keep up with the demand that I was getting from adult side. So I had to bring on, I was begging for such a long time to find like another doc. I was like, I need somebody else to be with me. I need somebody else to
Hmm.
be with me. Like I was refusing patients. I couldn't keep them on, right? I couldn't even like, because if I was booking a new patient, that means I was blocking, I think I was doing like 10 or 11 hours of private practice per week. So if I take an hour, right, that's 10% of my scheduling availability. So that knocks out, two, three patients potentially that
Sure.
I'm seeing on it, that I've been seeing for years. And it wasn't fair to them. So I had to kind
Yeah.
of say, hey, I need to kind of, stop taking new patients, which just creates this logjam of people. We saw it with a lot of therapists as well. My therapists were just booked constantly that I have working with me. But finally I was able to get some docs on board, and that, allowed another couple docs to come on board with me. And that's eased the burden a lot. But no, for sure. I mean, we were booked. We have plenty of docs, right? We have plenty of docs that we're, I mean, in regards that we're seeing as patients, right?
Mm.
I see plenty of nurses. I see social workers. I see psychologists and stuff like that as well. And it's the constant kind of thing of like, I can't even breathe, right?
Yeah.
That I mean, I can't even take a breath for myself to kind of recover because we're being so overworked.
Yeah, I agree. And you mentioned an interesting point how we have to be honest with ourselves and set boundaries with ourselves too, because there comes a point that when you're taking on new patients, at some point it's a disservice to the ones that you currently carry because
Yeah,
it's hard to like get the ones that the follow-ups in a timely manner, which
yeah.
ultimately negatively impacts patient care for the current panel, right?
Yeah, and that was something I was definitely like seeing, and like I was getting some feedback that like, hey, like I can't get appointments with you, or I mean, like that these things were happening that I was like,
Yeah.
I was getting that feedback, and I was like, I have to do something, and ultimately it was that decision. I was just like, I just can't take new patients, or I could take like one new patient per month essentially, and that was it. And when you're trying to help, and everybody's in a crisis, right? Everybody's struggling, and people are coming to you and they're really begging for help, right? They're literally begging for help. Please take me on. Please help me out with this. I have a daughter who's doing this. I have a son who's doing this. My brother, blah blah blah. Like, and you can't say do anything, right?
That's not a good feeling.
It's not a good feeling, right? It's just that feeling that, again, like for myself, I was like, that we talked about. You said mentioned burnout, like, oh, we were beyond burnt out, right?
Yeah.
um, it was well beyond that point.
Yeah, you bring up an interesting point how, as docs, one of our traits is that we're altruistic. We want to help. Like
I
that's
want to
why
help,
we
yeah,
went through, college, med school, residency. We made these sacrifices because we want to have an impact in the lives of other people. But and altruism is a good thing. It allows for like pro-social behavior. I think it's good that we care about other people. Um, Having said that, though, altruism can lead to suffering when you want to help, but you can't help.
yeah,
And think about how often that happens in medicine, for example, when there's too many people to help and not enough hours in the day, right?
yeah,
Or, often we see people who are treatment resistant. That can create some feelings in us of maybe feeling inadequate or helpless, right? I'm trying to help this person. I've tried everything that I can think of, and I haven't been able to help them, right? That can trigger some feelings in us.
yeah. No, and just to clarify, treatment resistant is not like a patient thing. Like it's
Yeah.
one of those things I hear from people are like, well, are you calling me treatment resistant? And
Oh,
like that I'm not doing anything. It's like, no. It's the treatment that are supposed to work for you are not working. It's not
yeah.
because of whatever something that you're doing. It's just something the treatments or maybe something on our end that we're doing wrong as well. And there were definitely times where I would like think at night, I was like, man, like I think as psychiatrists we're usually pretty good at our job, right? We have a lot of people that we help out and we have a benefit with, but the ones that are not, right, or the things that are out of our control, like they stay with us, right? They stick with
Of
us,
course.
and I would think about them and I'd be like, man, what am I doing wrong? I need to be doing this. Like, is there something else I should be doing? And that has an effect on us, right?
Yeah, and there's limitations in the interventions that we can offer. Like these medicines
Yeah,
that we prescribe, for example, they don't bat 100%,
right.
right? They don't have that kind of a response rate. So thank you for clarifying. Like when we say
Yeah,
treatment resistant, we're not saying anything negative about the human being, the patient that we're treating. We're just saying that some of the interventions that we have limitations and
yeah,
further advances are necessary in psychiatry and healthcare overall.
yeah.
But it's not a good feeling when you're trying to help someone and the tools that you have available to you they're not working. That creates some difficult feelings for us.
Yeah. Or other things, even, when I'm working with kids
Mm,
and, we're trying to work over a telepsych, right, over the video. And, video appointments in psychiatry are fantastic for people like us, right?
yeah.
For adults. For a lot of times with kids, they just don't work. You just can't do that. You need that hidden room. And then we had a lot of kids who were just suffering because of that, just because they weren't able to access care for a long time. So, and then, I mean, I would, again, like when I'm working with nurses, and they were dealing in the midst of the pandemic, right? And patients dying. And, I'd always ask them, I was like, how are you doing? How is that
Yeah.
going for you? Like, what were things that you were hearing from, again, people that you were necessarily maybe working with during the throes of it?
During the throes of it.
Yeah.
It was very difficult. People were very scared, right? Because we didn't
Mhm.
have as much information on the virus, right? So people were terrified going to work and then bringing this lethal virus home. So they were terrified. I noticed an increase in OCD behaviors like
Mm.
excessive hand
Yeah.
washing, like doctors or nurses like taking their clothes off in the garage and spending an excessive amount of time decontaminating. So I observed some of an increase in those behaviors. A lot of anxiety, a lot of worrying for the well-being of their loved ones, a lot of trauma.
Yeah.
Seeing young people die from the virus, it's traumatic because you
Yeah.
see somebody in their 30s and 40s dying. Well, that's the age that we're in, right? You can see how it can stir up some existential fears
Yeah.
that we may have, right? So it was difficult for people to during that time frame in the throes of it.
Yeah. And, like I'll say for myself, like when I got sick with COVID, right? I got COVID from my student actually.
Mm,
And this was in November of 2020. So right before the vaccines came out. So
mm,
this was like OG COVID, right? And that put me in the
mm.
critical care unit of the hospital that I was at. So I was like hospitalized and I was bad and everything like
Wow.
that. And my wife got sick from it too, because there was that lag time between when I was told that there was an exposure and then when everything from there, from when I started exhibiting symptoms, that guilt, right? I was like, oh
Mm,
God, I got my wife sick. I could have gotten my kids
yeah.
sick, like all this stuff. Like, and thankfully she was totally fine and no problems with it. And the kids were fine and everything like that. But still, like, I hear what you're saying, right? And like, I know my wife like, also is a nurse. She works in the hospital.
Mm,
Um, similar kind of stuff. She like changed, she come inside, change immediately, hop in the shower, right?
yeah. Yeah, no, definitely. We were like dodging air particles at that time, right? I mean, that's how it was.
Yeah.
It was a very scary experience to go through.
And then like since then, so since like let's say like post vaccine initiation rollout and then like things settling down, like what other things have you kind of noticed amongst docs and other healthcare workers?
Well, again, the one thing that I'm observing is the fact that many hospitals are short-staffed,
Yeah.
right?
Yeah.
Having a hard time having the proper level of support, in an ER, in an ICU, right, in critical care, and the doctors are burning out,
Hmm.
because they're taking on more and more patients. They don't have that support from staff that they're accustomed to. Like it's different if you're ER doc or ICU doc and you've worked with a nurse for 10 years and you have that rapport with them and
Yeah.
they can read your mind, like you guys know what to do when you see a case. But when you're working with somebody fresh out of school
Yeah.
or you're being short-staffed, you're not sure how they're going to like handle that case. You're not sure what kind of care they're going to provide. So it puts more pressure on the doc, right? So I've been noticing a lot of burnout
Hmm.
since in that phase of COVID, where maybe we're not as afraid of the virus because we're vaccinated, or we've had it before. So, we know how our body's going to respond to it. But now hospitals are having a difficult time with infrastructure
Yeah.
and providing docs with the support they need to provide the care that's essential for patients.
For healthcare workers, docs who are hesitant to reach out for care because they're concerned about stigma, right? Stigma,
Mm.
we know that exists. There's concern about like somebody's going to tell my hospital I'm going to lose my job. Somebody's going to, seeking out help for some potential substance use issue. What words would you have for them to say, hey, let's do something?
Yeah, I think the first thing that I would say is that you can only suppress things for so long before they take a toll on you. Like it's only a matter of time that you suppress your thoughts, your feelings before they start to impact your ability to practice medicine. You can only drink so much, you can only be so much sleep deprived, you can only, carry so much depression and anxiety before it takes its toll. Um, and when you get care, it doesn't just make you a better physician, it also makes you a better spouse, it makes you a better parent, right? And when you love someone, you get care for them as well, right? Because you want to
Yeah.
be the highest version of you, not just for you, but also for those in your life that you care for deeply. Um, so care can take on different forms. You may call, for example, the physician support line, and I can share you that number. Where I think they're available Monday through Friday, 8 a.m.
Yeah.
to
Yep. Yeah.
midnight, right? And they provide free care. Just making a phone call, right, and having a conversation with a fellow psychiatrist, a fellow physician. So that might be one avenue. Another avenue may be just, seeing a therapist,
Yeah.
somebody who's a medical, oh, excuse me, a mental health professional,
Hmm.
and just having a conversation with them about what you're going through. And you'd be surprised just getting things off your chest and being seen and being heard. It has a tremendous impact on one's mental health.
Yeah. Talking with people helps, right? Getting
Amen.
just getting it out in one way or the other, either with somebody who understands you, may not
Yeah,
have all the answers, but at the same time is like, I hear you. It sucks, right? That makes a difference, right? That empathic validation of like that sucks, and yes, it does suck, and you're right to feel like that makes a difference when somebody else gets
sure.
that for you. And then for when you're working with them, like what are some things that you do maybe differently or helping out with that with
Yeah.
them with
I
this
mean, I meet people
population?
where they're at. My number
Yeah.
one goal when I meet someone is to build trust, to provide a safe environment where they can trust me with whatever thought or feeling they have. So I meet people where they're at. So there's some docs, for example, who they're very comfortable with a medical model and they don't want to talk about thoughts and feelings and they just want like a little bit of an antidepressant to make it through the day. And they see me every 3 months for a refill of the medication and we keep it at that level. And then there's other docs who I see every week for therapy and they do not want any medications. They don't, because if you call in a script to a pharmacy, the pharmacy can reconcile that medication with an electronic medical record, and then it's on their medical record that they're on a medication. So they want to focus on therapy. They want to work on coping skills, challenging cognitive distortions, um, find ways to solve and address, stressors in their life. So the goal is to be flexible and to
Yeah.
meet people, I think, where they're at and to build trust. And I think once you've built that relationship, then the work can evolve. But if the person doesn't feel like you care for them, the work won't go anywhere, right? That therapeutic alliance, that relationship is an essential ingredient for healing.
Yeah. how often do you see like docs kind of being a little dictating how they want their things to go, how they want treatment to go for you, for them?
I would say that's the minority.
Yeah.
I would say, uh, I'll say this about docs. I better know my stuff because they know their stuff.
Yeah.
And I get questions in depth like, well, what's the half-life of this medication and why this medicine over that medicine, right? And
Yeah.
will this cause weight gain? And they want studies. So I better stay on top of it because they really question, not to challenge, but because they want to know, right?
Yeah. Yeah.
So that's been my experience. But I think once again, you provide a safe environment and you earn trust. You earn trust. I think at that point, they're willing to work with you. Um, uh, but and they have to be involved in decision making too.
Yeah.
I can, and this happens with all patients where it's like, here's
Yep.
my
Yep.
recommendation, here's what I think would help you, and here's why. But if you don't want that, that's okay, and I'm still willing to work with you, even if you don't want to go down Route A. So that's been my experience. The majority they don't dictate, they work. And I would say if the patient, if the client, if is dictating the work on a physician, I think that's a red flag because you can see how that can compromise quality of care, right?
Yeah.
So yeah.
Yeah, no, it's definitely something that I mean, like I don't come across it. I don't see it either. I agree with you. Is that a lot of times they're if they're in a position where they're like, hey, I'm here in front of you, like I'm here because I need help, and I'm going to trust you,
Sure.
and you're right, and I'm not going to cause any issues or problems with that. So,
Yeah, yeah.
do you see? I mean, how often, and then like, how often are they open and honest about their substance use and stuff too with you?
Typically, people aren't open with that in the beginning.
Hmm.
Trust is a process, right? We build trust.
Hmm.
And what happens with people is they'll give me something like a safer piece of information, something superficial. They see how I respond to that. And as you build trust, then you dive into deeper issues such as trauma, such as substance use. But typically that doesn't come off initially. Um, and I think that makes sense. That's wise, right?
Yeah,
Like you've never met me before. You want to get a feel for me, just like I'm trying to get a feel for you in a session, right?
yeah,
So they might keep it more pragmatic as far as a problem initially, like, hey, I'm having a hard time sleeping, and we'll talk about that. And as we build trust, and then they'll give me more and more sensitive information.
yeah. I get that, and then I mean, there's definitely like some people that come to me for that specifically because they're like, oh, I know that you're expert or so a quote unquote expert in this topic, so they're going to come directly to me for that. Um, but yeah, no, it is that aspect where it is, with any kind of patient, doctor is
Yeah.
it's that give and take. Some people are going to be more forthright in the beginning than other people are going to be less so. So
Yeah, I agree.
do you, so there's a question that says the
Hmm.
physician heal thyself mindset can sometimes lead to self-neglect amongst providers. I know we talked about this a bit. How can we shift this to kind of say, get your self-care in there, do your mental health work? How can we do this amongst ourselves to preserve ourselves?
Yeah, I mean, the physician heal thyself, as I think about it, it puts the entire responsibility on the physician and it reinforces that culture of stoicism. Like, you have to do this all by yourself. You have to figure out a way to get it done, right? And when living in secrecy and living alone and being in isolation, it reinforces suffering. It allows for thoughts and feelings to grow and fester and to take over. And I think what we need to recognize is that we're human beings as physicians. And I
Yeah.
find that quote to some degree dehumanizing. Like, you have to find a way to take care of yourself as if we're not human beings who need help like everyone else. And I think we do that by normalizing the fact that doctors need help. State medical boards, they have to stop asking questions about our mental health conditions or mental health
Yeah.
treatment, and they have to realize that getting care makes you a more competent physician. Hospitals, I believe, have a moral obligation to create programs that provide physicians and other healthcare providers with free and confidential care to physicians, not like an EAP, an employee assistance program that's very maybe vague, but like people who have experience and expertise in treating this population that faces unique systemic forces. And also, again, we have unique personality traits that make us vulnerable to suffering. So I think once, again, we normalize care, once we continue to reduce the stigma associated with us getting care, I think at that point, we will realize that physician heal thyself is not a fair or realistic expectation. One can argue it's a form of gaslighting.
Yeah.
Right?
It is absolutely gaslighting. And like, I mean, the last thing you want to do when you're done with your work is see yourself as a patient, right? And treat yourself as a patient, right? And then you're like, oh, one more person, myself to take care of, right?
By yourself though, not just
By
like,
yourself.
there's a difference between like us engaging in habits and practices to promote self-care and wellness versus you have to heal thyself,
Hmm.
right? There's a
Yeah.
huge difference between the two, I believe.
Oh, no, absolutely.
Yeah.
Because again, like we're supposed to just suffer in silence and deal with
Hmm.
that.
Yeah.
You brought up an interesting point. There's the unique personality traits that come along with docs. What are some of those that that you see? Again, not to like, talk
Yeah,
shit about
no,
people, but
and
like,
we're generalizing, but it
yeah,
takes certain personality traits to like say that I'm going to extend school by another decade and take on six figures of debt and delay my earning years till my 30s. It takes a certain personality trait. So, in general, as doctors, we're perfectionists. We do not give ourselves any margin for error because a perfectionist thinks I'm either perfect or I'm a failure.
yeah,
There's no in between. And it makes sense because medicine reinforces perfectionism. You make a mistake, you can kill another human being, you can really hurt another human being, right?
right, right.
So in general, we're perfectionists. In general, we're altruistic, right? I sure hope so, because we're trying to help other human beings. And again, altruism is a beautiful thing. It allows for pro-social behavior. At the same time, though, altruism can come at a cost to our mental health when we're always caring for others and not ourselves, or when we're in situations where there's limitations in what we can offer.
Yeah,
In general, as physicians, we're type A. We're type A workaholics, right? I think there was a survey that showed that 58% of docs are type A, and I joke that the other 42% were type A, they just didn't know it. Because, again, it takes a certain personality to
yeah,
work these 24-hour shifts and to
hmm
take these exams, these boards that are, I don't know, 12 hours long. I've lost track how many hundreds of questions we have to
yeah,
answer for these steps, these boards, right? So these are some traits that we have. And again, they're useful within the practice of medicine,
yeah.
but outside of medicine, they can make us vulnerable to suffering.
And then there are the people who are narcissistic as well. That those people show up as well within the field, and those people are harder to kind of reach sometimes, right?
Yeah, and narcissism is on the rise.
Yeah,
When we look at the data from a societal point of view, empathy's on the decline, perfectionism's on the rise, narcissism's on the rise. And what I try to teach people is that behind that narcissism is a lot of inadequacy, feeling of inadequacy and guilt and shame. And the antidote to those feelings is not narcissism, it's humility. The
yeah,
recognition that you're no better or worse than anyone else. Like just because you're a doc, it doesn't mean that you're better than anyone or worse than anyone. You're a human being and you have some strengths and you have some weaknesses. And let's maximize your strengths and let's minimize your weaknesses so you can have a positive impact in your life and the
yeah.
life of those around you. But narcissism is very, very toxic and it
Oh yeah,
really hurts interpersonal relationships.
yeah. They have huge impacts on, especially when we're talking about like in trainee, GME, kind of like the educational hospitals, which are training hospitals, on trainees, right, on residents.
Sure.
I work with, again, I have patients who are residents who are dealing with this kind of stuff where they're like, my program director is this, my, head of the division is this. And like, it's pretty terrible, the stuff that I hear, right? The
Yeah.
environment, that's the culture that's kind of being perpetuated in certain programs,
Yeah, and that's what
places.
happens there. It's perpetuated, right? That was
Yeah.
really well said. Where, okay, so you're in this residency program 3, 5, 7 years. What did you learn from your leader to be a narcissist?
To
And
be
what are you
to
going
be
to
an
do when you
asshole.
have a leadership position? Pass
Yeah.
it on.
Yeah.
It's for survival, right?
Yeah.
People put on these spears, these shields, this narcissistic facade because they're afraid to be vulnerable and human. So they present themselves as being more than, which only hurts, again, the culture of a program.
Yeah. You talked about, um, we've talked about like kind of like ideal kind of resources. And again, I think what you guys are doing over there in Akron is fantastic. It's needing to be more and more because again, just it is a universal problem that's there. What else can people do? Organizations do, healthcare leaders, what, the quote unquote healthcare leaders who
Yeah.
are MBAs, what can they do to help the people who are making money for
Yeah,
them?
as I think about it, I think one thing that they can do is involve physicians in the decision making. So hospitals are experiencing challenges, no doubt,
Yeah.
right? They're experiencing financial difficulties, they're experiencing staffing challenges, right? And the reflex for the person with the MBA is, how can I get more out of this doctor? How can I make them to produce more? And again, that's a very short-sighted solution that ultimately leads to burnout, which
Yeah.
costs the hospital money. When a doctor battles burnout, it impacts patient care,
Yeah.
it impacts the hospital's bottom line, and when they quit and they go to a different hospital, a competing hospital,
Yeah.
it costs the hospital itself half a million to $1 million to replace that doctor.
Yeah.
So what I would say to like leaders is engage your physicians, like get them involved in the decision making, share data with them, like, hey, our hospital is losing X millions of dollars. What can we do together to find solutions to help turn the situation around? And when you engage people, they come up with the best solutions. My experience with patients has been, patients come up with better solutions than me
Yeah.
because they're living their lives. They know, they're in the trenches of their life. They know better than me what's going on and what works. But you got to engage people. And the
Yeah.
same thing with physicians, like engage them in the decision making and give them a sense of recognition and autonomy, instead of just, coming down unilaterally, which ultimately builds feelings of resentment and resistance and burnout.
Yeah. And it should be a little bit more choice and stuff than
Yeah.
just like what toppings you want on your pizza that we're giving you guys to cure
Yeah.
your burnout, correct?
Yeah, definitely.
Yeah, no, I think that's a huge thing, right? And we see this kind of pushback at times too, is that like we'll come up with ideas. I know, like, oh, I've sat in plenty of meetings where it's like, oh, what can we do? And we're going to address burnout. And I'll be like, less documentation. That'd be great. Less forms. Let's do this. And then they're like, okay, cool. Here's some more forms for you guys to do, right?
Yeah.
Here's some wellness modules for you guys to do. Here's some things to do. Like, that's not it, right? That's not the thing that we need.
No, I agree. And like these wellness modules on how to be more resilient, they're insulting.
Yeah.
Even the most resilient docs suffer, number one. Like studies
Yeah.
show that like even the most resilient suffer. But number two, the fact that we made it this far is evidence of the resilience. The
Hmm.
fact that we made it through med school, the fact that we've worked 24 or 30-hour shifts, the fact that
Yeah.
like we've made it this far is evidence of the resilience. So don't tell a doc how to be more resilient. Engage the doc in coming up with solutions to address these systemic factors,
Yeah. Yes.
right?
Yeah, absolutely. What can we then? So that's
Mm.
the healthcare place, the hospitals and stuff. But as a society, what can we do? How can we kind of raise awareness about this or address the challenges that our docs are kind of facing?
As a society to like let I'm trying, can you rephrase the question? I'm sorry. Can
So
you?
like, so what can people do? So people who are not in the hospital system, right? So people who are, again, non-medical people, what can they do to help out docs to kind of realize and say, we hear you. We hear that you guys are struggling. We've beat you guys up a little bit, and we're angry that you forced us to stay inside and wear masks and get these jabs, quote unquote. What can we?
Yeah.
What can society do to kind of say, you know what? We don't want you to kill yourselves because we
Yeah.
realize that you guys are killing yourselves at these astronomical rates. We see that you guys are drinking yourself to death and drugging
Yeah.
yourself to death and etc. Like, how can society support docs?
I would say perhaps advocate for doctors. I would say reach out to your local senator. I would say write letters and inform them of the situation and, encourage them to ask to create, programs that provide doctors with free and confidential care where they're not worried about their license. You want to provide care to doctors more upstream. Once people have been reported to the medical board, just too downstream at that point. Like the damage has already been done and it's quite significant. Like you want to be able to provide care to somebody at the initial stages of a physical or mental health condition, right? So I would say, reach out and, to, hospital leaders and to, political leaders, people who have authority, and write to them and help them understand that, like, if doctors are not doing well, everyone's going to be impacted. The healthcare system is going to be impacted. And ultimately that hurts human beings who take their dad, their mom, their son, their daughter themselves to the hospital. Because if you're seeing a burned out doctor,
Yeah.
there is a good possibility that the quality of your care will be impacted,
Yeah.
right?
I don't know like the specific data and everything like that, but like the quality of care goes down significantly. We know that, I think this is the initial data was out there was like the more hours the doc works, like the errors increase, everything beyond. Again, this is why we have like all the duty hour limits and stuff, is because the people were essentially working at a level where they're drunk, right?
Yeah.
They're practicing medicine or doing X, Y, and Z surgery, whoever else working in the emergency room, and they were like essentially intoxicated because of the fact that how long that they had been sleep deprived or working for.
Oh, I agree with you totally. Absolutely. Those changes were necessary.
Yeah,
But, I think if people can understand what we're going through to some degree and they can advocate for us, I would think that would be tremendously helpful
yeah.
to our cause.
What can docs themselves do proactively, right? So trying to get ahead of the curve to prevent themselves from kind of getting into a situation where they're like, have to see one of us,
Yeah, I would
hopefully.
say, yeah, no, a great question. I would say number one, check in with your colleagues. Studies show that when we have healthy relationships, that is a protective, that's an antidote to burnout, having strong, healthy relationships with one another, So that's one thing. And then prioritizing, your wellness as much as you can. And again, I'm not saying physician heal thyself, but I
Yeah,
am saying physician set boundaries with work, and remember that work is one part of who you are, and you're also a father or a mother or a son or a daughter or a sibling, and
yeah,
to make sure that you prioritize your wellness. And look at it from a biopsychosocial model. That's how I look at it in my life, where I engage in physical activity regularly. Now, again, I work out when the kids go to bed 9 o'clock at night, but that's when
yeah,
I get to work out in my basement. Practice either mindfulness or gratitude. I practice gratitude every morning because it's easy for me to go down a negative thought process and to forget whatever blessings I have in my life. And I like to start my day with thinking about one blessing, not just thinking it, but feeling it. Feeling grateful for my son or my daughter or my wife or whatever I have in my life or I don't have.
yeah.
And number three, relationships again. They're essential for promoting mental health. Now, again, these individual strategies, they're not going to solve everything, but they can at least help you tolerate the challenges of practicing medicine.
Yeah. And you had said it before too, is that like these are, some of your things, right? Those are things that are going to work for you and they're not necessarily universal, right? Like I do a similar kind of thing with my patients. They're like, "Oh, Dr. Mirza, what can I do to kind of like feel better?" I was like, "I don't know." And I say, "What do you do to feel better? What are the things that you do to kind of feel better?" Right?
Yeah.
I was like, "I enjoy playing video games. Like that does not mean that that's going to work for you, right? I enjoy working out, and I have a garage gym, not this basement gym, but a garage gym. But like,
Yeah.
I enjoy spending some time over there and clanging and banging in there. Again, is that the thing that's going to work for somebody else who may not have that access? Of course not, right? So, who may not enjoy that kind of stuff, or may have some disabilities that limit what they can do. Like,
Sure.
right? That's obviously that's not going to be the thing for them. But it's just this idea that like everyone has to do mindfulness and yoga and X,
Yeah.
Y, and Z. Like again, these are ideas or starting points, right?
I agree. I agree. And again, the best ideas come from our patients, right?
Yeah,
And
yeah,
what I tell people is, because there's so many things you can do, there's like hundreds of things that you can be doing.
oh yeah,
But I would say pick a couple that you think might be interesting. They sound something that you want to try and give it some time. Like
yeah,
if maybe you want to go for a walk for 10 minutes a day, and try that for a few weeks and see how you feel after having done that. Or maybe you just want to go out and stare at the sky, whatever. Pick a few things that you think you would like and stick with them consistently, because in general, the unhealthy stuff that we do, it kicks in fast, but it comes with baggage. Whereas the healthy stuff, it takes time to reap the benefit.
Yeah.
You work out once, not as helpful. You work out 30 times, that's when you really see the benefit, right?
Yeah. And I'm reminded of the meme that I see all the time of like, I'm doing my stupid mental health walk for things, and like it's stupid working for me, and now I'm angry that it's like working, and
Yeah.
it's the reminder that like, hey, you got to try this stuff, and
Yeah.
if you find it to be useful, stick with it. And if you don't find it to be useful, there's other things.
There's
So
other things. Keep it simple.
yeah,
Keep a few things and do them consistently is what I would say. Yeah.
yeah. You had mentioned some stuff, but what is your self-care? Wrapping up a bit. So
Yeah,
what is
definitely.
your
I work
self-care?
out.
Yeah,
I work out 4 to 5 times a week in the basement, 9 o'clock at night.
yeah,
Sometimes Saturdays I'll go to like the local gym just to kind of mix it up and see some people. I love to write, because there's something about just being creative, having a blank piece of paper and just pouring my thoughts on there and seeing what comes out of it. I mean, 3 hours fly by like it's nothing. I love being with my kids,
yeah,
I just love like Saturday mornings, taking them to soccer, just watching them compete, and just kind of cheering them on, just being a kid with them sometimes. Gratitude, I do that every morning, just 1 minute, feel grateful for something in my life or someone,
yeah.
because it's easy to forget uh, the blessings that we have and get wrapped up in the negativity. So those are things that I do pretty consistently for years now.
Nice. Good, good, good.
What do you do? Let me ask that. What do you do, by the way? You mentioned the gym, and what else?
Yeah, so I'm a new father of a 5 month old now.
Oh,
So
congrats.
that was, thank you. That was child number 4. So it wasn't
Oh,
like we took a little break in between number 3 and number 4, and I was like, all right, here we go again.
how old is your
Um,
oldest? How old is your oldest?
he's 8. So he's,
Okay,
we
okay.
went, so right now they're 8, 7, 6, and 5 months. So I'm just like, what
Mm,
the hell's wrong with me? We have a doctor and a nurse who definitely have a firm grasp on birth control and how
yeah.
everything works. But no, so that was the main thing. I spent time with them. We do like a Friday night movie night. I spend time. We
Yeah.
go to my in-laws' place a lot of time. We're close to my in-laws. Again, like I love playing video games. I do like a lot of the content creation that's there. I enjoy,
Yeah.
again, like the TikToking and
Yeah.
Instagramming and tweeting and all that stuff, because it's a way to connect with other people, right? We've
Definitely.
kind of siloed ourselves a little bit, and it's definitely a way to connect. And I have buddies come over for like UFC nights and boxing nights and
Okay.
all that
I
kind of
used to
stuff.
watch the UFC back in the day. I was a huge Anderson Silva fan.
Oh
I
yeah,
thought he was
yeah,
the greatest of all time. Him and John Jones.
yeah.
But I
Ja-
feel like it's changed lately, hasn't it? The UFC. It's not quite the same since it went with ESPN.
it's different from that regard. Like you can't
Yeah.
like bootleg the streams anymore. You have to actually you have to actually buy the pay-per-views to watch them
Yeah.
now.
Yeah.
But I enjoy it. Like I was talking with Chris and Casey about it a little while ago when I had her on. Was like, I love the fact that it's so diverse, right? Because there's
Yeah.
this image now that like that UFC is like a MAGA country and it's MAGA this and white power and supremacy, and it's like it's actually not when you look at it. Like it's
Yeah.
the champions are super diverse. It's super
Sure.
international. People are Brazilians. Again, like I say all the time, like I'm a Muslim, and like it's the
Yeah.
one sport where like Muslims are representing and are champions as well. And like, we have somebody to look up to and our kids to
Definitely.
look up to and be like, you can do this. You can be a champion in a sport. And it's not just, the people that we see in NBA, NFL all the time,
Yeah.
right?
Who's your
So
favorite fighter?
Kamaru Usman's my favorite guy.
Okay.
I like Usman. I like Israel Adesanya. I like him as well.
Middleweights. They're
Yeah.
right.
Yeah, so yeah, John Jones just went up to heavyweight. So
Yeah.
I loved Francis Ngannou,
Yeah.
some of those guys. Yeah. So Silva was just a little bit before I got into it. I really got into it when Connor was coming up. But he was somebody that I enjoyed hating Conor
Oh
McGregor,
yeah. Yeah.
right?
Definitely.
So yeah, he
But
was
that's what
somebody
made
that
I thought the UFC easier to follow before because there were fewer fighters and you can figure out their personalities.
yeah,
Whereas I find it right now there's like so many fighters that I'm having a hard time, following a few of them. It's just because
yeah,
there's so many of them.
yeah.
Right now I'm a Stipe fan, heavyweight. He's from Cleveland,
Oh
right?
yeah,
Stipe
yeah, yeah.
Miocic. So fan of his, obviously.
he's got a big fight coming up in November, so I'm
Exactly. Looking
thinking
forward to
about
it.
thinking about going to that one at MSG, but we'll see.
That'll be cool.
Yeah, no, I've always I've been a big professional wrestling fan.
Oh,
I've
me,
always
same here.
enjoyed I've always enjoyed the theatrics of it and the athleticism of it, and how
Athleticism.
the athleticism, people don't realize. They're like, oh, you're just faking it. I was like, no, but it takes a lot of work to kind of quote unquote fake this stuff, right?
I agree, and it's an art too, right? They're
Yeah,
telling you a story on the microphone and
yeah,
on in the ring. They're telling you a
yeah,
story. So yeah, I'm a WWE fan as well.
yeah, yeah.
Yeah, so definitely
So
enjoy that stuff. Yeah,
So I've always enjoyed that stuff. I've taken the kids to some of this stuff, and they're always like, now they're getting into it more and more. So
yeah, it's cool.
that's my self care. So,
Yeah,
and then the last question, right, is your favorite, because I'm the kick shrink, right? So your
yeah.
favorite pair of sneakers,
You're
if
not
you
gonna
have a
like this.
pair.
I'm a LeBron guy. I'm from
Oh
Cleveland,
no.
and he's the reason we have a championship here. And he ended the drought for us since 1964. So if
Yeah.
it's LeBron, I'm buying it. I'm a huge LeBron fan. I know he left us for LA and Miami,
uh,
but you know what? I still love the guy because if it weren't for him, we would not have this title. And again, every time he left, our team's tanked. So he was the team all those
he,
years, and he's still
he,
going strong. Let's give him some love, right? I mean, he's what, 38 and
or
still going
something like
strong.
that. Yeah. No,
So I'm a LeBron guy.
I've been like an MJ guy and a war. I'm a big Warriors fan. So like,
Yeah,
he took that one from us. And I remember I went to a wedding in Cleveland a few years ago, and it was actually after the Cavs won it. So as soon as I get off the airplane, right, I think it's like once you get right there, first thing I see is like the 2000 was a 17 champion Cleveland Cavaliers. I was like, oh my god, get me back
yeah,
off, get me back on the plane. I'm out of
yeah.
here.
And can I say
Yeah.
this? I feel like this team should have had that too. Kevin Love and Irving. Kyrie got injured.
Yeah.
I feel like it should have been 2-2, but I'll say 3-1. How's that? We'll settle for 3-1.
We got you the three, and it was
Yeah, you did. You did.
so all good. Well, any last parting messages for anybody who's listening or watching?
Yeah, no, again, I appreciate the opportunity to be on the podcast, and hopefully we provided people with some useful information that they can incorporate in their daily lives, and not to hesitate to reach out if they have any questions or want further information.
Yeah, we'll definitely drop the links for everything and your socials and all that stuff in there
Yeah,
as well. So your main thing is Twitter, correct?
yeah, I'm a Twitter guy. I can't figure out Instagram. I just copy and paste my tweet onto Instagram.
That's all good. That's all good.
Yeah, yeah,
So, all right. Well, Dr. Dimitrios, thank you so much for your time and your work and your kind of service. I know it is so invaluable to our peers that are going through this stuff.
yeah. Thank you, Dr. Sulman. Pleasure catching up again.
Definitely. We'll see you. Bye.
Bye.